Hyperlipidemia or high cholesterol, symptoms and treatment. Hyperlipidemia or high cholesterol refers to elevated levels of fats in the blood. People may not experience any symptoms, but having hyperlipidemia can increases the risk of developing heart disease. In the United States, about 1 in 3 people have hyperlipidemia. In this video, we explain the causes and symptoms of hyperlipidemia. We also look at how to prevent and treat it. What is hyperlipidemia? Hyperlipidemia means there is too much cholesterol in the blood. Cholesterol is a waxy fat molecule that the liver produces. It is essential for healthy cell membranes, brain functioning, hormone production, and vitamin storage. There are two types of proteins or lipoproteins that transport cholesterol to the cells: low density lipoproteins or LDL or bad cholesterol, and high density lipoproteins HDL or good cholesterol. LDL has damaging effects on health. HDL, however, counteracts the effects of LDL. HDL is good for health as it carries excess cholesterol back to the liver for excretion. The liver then eliminates cholesterol through bile. LDL that remains in the bloodstream damages health because it allows excess cholesterol to build up in the blood. Triglycerides are another type of fat in the blood. They are not a type of cholesterol but have a strong association with heart disease. As such, doctors also measure triglycerides levels in people with hyperlipidemia. A person can develop hyperlipidemia if they have one or a combination of the following: high LDL levels, high HDL levels, elevated levels of triglycerides. The following table highlights the ideal cholesterol levels. Overall cholesterol under 200 milligrams per deciliter. HDL cholesterol for men more than 40 milligrams per deciliter, for women more than 50 milligrams per deciliter. LDL cholesterol. Otherwise healthy people less than 100 milligrams per deciliter. People with heart disease or diabetes or poorly controlled risk factors less than 70 milligrams per deciliter. Triglycerides less than 150 milligrams per deciliter. Symptoms. Usually people with hyperlipidemia do not experience any symptoms. However, those with familial or inherited hyperlipidemia may develop yellow fatty growths around the eyes or joints. A doctor usually detects hyperlipidemia during a routine blood test or following a cardiovascular event such as heart attack or stroke. An excessive buildup of fat over time can cause atherosclerosis. This is when plaques develop on the walls of the arteries and blood vessels and narrow the openings. This can lead to unstable blood flow through the vessels and can greatly increase the risk of heart disease and stroke. Causes. The causes of hyperlipidemia include genetic factors. Doctors refer to this as primary hyperlipidemia. A person inherits this type from their parents. Poor diet and other factors. Doctors refers to this as secondary hyperlipidemia. Other risk factors include excessive alcohol consumption, obesity, taking medications such as hormones or steroids. Diabetes, metabolic syndrome, long-term kidney disease, premature menopause, an underactive thyroid gland or hypothyroidism, pregnancy, secondary sedentary lifestyle. Familial hyperlipidemia stems from a genetic disorder. A parent passes down a mutated gene that leads to a missing or malfunctioning LDL receptor. This means that the body cannot clear LDL from the bloodstream, which can result in dangerous levels of LDL in the blood. Treatment: self-management of hyperlipidemia through a balanced diet and regular physical activity may help a person reduce levels of lipoproteins in their blood. However, genetics also determine cholesterol levels, so a healthful lifestyle may not always be enough to reduce cholesterol. Some individuals might require medications. Typically, doctors prescribe statins such as simvastatin, lovastatin, atorvastatin, and rosuvastatin for reducing cholesterol. These medications decrease the amount of cholesterol the liver produces. Statins can cause side effects, including muscle pain. The muscle pain is usually harmless, but in rare cases, statins can cause muscle damage or breakdown. Anyone who finds the pain hard to tolerate should talk to their doctor before stopping taking the drugs. It is essential to balance the risk of a cardiovascular event against the risk of side effects before stopping treatment with statins. People whose cholesterol levels do not reach their desired target after taking statins may need higher doses of statin medications or additional medications. This includes people with inherited hyperglycemia who may not otherwise be able to take the medicine they need, or those who have had a heart attack and cannot achieve their LDL goal with other drugs. Prevention. Lifestyle and dietary options are an important way to prevent and treat hyperlipidemia. Options include eating a heart-healthy diet, taking regular exercise, not smoking, and maintaining a healthy body weight. Diet. A heart-healthy diet includes minimizing the intake of saturated fat, trans fats, and dietary cholesterol, and consuming a variety of whole fruits and vegetables, plenty of fiber, lots of water, and whole grain foods. People should try to restrict or eliminate fast foods, high carbohydrate foods, and any processed foods or foods that do not offer good nutritional value. Fish, nuts, and legumes contain healthful fats, so can provide benefits for people who need to reduce their LDL cholesterol levels. When using oil, choose olive oil or another oil rich in monounsaturated fats. Weight. People who are overweight or have obesity are also at greater risk of developing hyperlipidemia and heart disease. Losing weight can help a person reduce LDL, total cholesterol, and triglyceride levels. It can also boost HDL, which helps to remove the LDL from the blood. Physical activity. A lack of physical activity is another risk factor for heart disease. Regular exercise and activity help a person reduce LDL, raise HDL, and encourage weight loss. The American Heart Association recommends people to 150 minutes of moderately intense physical activity every week. Not smoking. Smoking triggers many problems that contribute to heart disease. It promotes atherosclerosis, increases LDL levels, and encourages inflammation and the formation of blood clots. Quitting smoking will result in higher HDL levels. This may be one reason why the risk of cardiovascular diseases decreases after a person stops smoking. A person with hyperlipidemia can reduce the risk of cardiovascular problems later in life by strictly following the diet and treatment plan recommended by their doctors.